A new Boston Consulting Group study showed that 64% of Filipino families cannot afford a 10,000 peso hospital bill without borrowing or using insurance. The study, titled The Filipino Family, surveyed 1,500 families nationwide. The numbers get worse. It showed that only 9% of families can cover a hospital bill of up to 100,000 pesos. For bills of up to 300,000 pesos, only 6% of households say that they can shoulder it. And for medical bills of 300,000 pesos up, only 4% of those surveyed say they can take it on, again without borrowing or relying on HMO. So not surprisingly, the survey showed that 7 in 10 households identified being financially prepared for health emergencies as their top priority, surpassing even savings, education, and home ownership. 68% say they prioritize having a large savings fund, and 64% are striving to improve nutrition and food quality. What this tells us, the authors say, is that family priorities are overwhelmingly defensive, aimed at preventing financial shocks. All right, to break down this study further, we're joined today in the studio by Lance Katigbak. He's a principal at BCG Manila. Good morning, Lance. Thanks for joining us all the way here.
Good morning, Regina. Thank you for having us.
Unfortunately, we have pretty sobering numbers to dissect here. Let's start off with the headline. A staggering 64% of Filipino families say they cannot afford a 10,000 peso hospital bill without borrowing. What's the story there?
I think the story there, Regina, is that I think for a lot of families, they really fundamentally feel that healthcare emergencies are something that are so potentially destabilizing for them. When we asked them, for example, what are your top fears? Everything was really centered around anything that could destabilize the family unit, whether that's inflation, losing a job, or somebody getting sick. And so we know that for a lot of people, HMOs usually tend to cover only the working, the healthier adults, and there's usually lower coverage for seniors and for young children. And so what we found in the survey was that, if you actually took away that HMO, a lot of people felt that they would be very hard pressed to cover a healthcare emergency.
Yeah. It's not surprising that many Filipino families are, as they say, one healthcare emergency away from financial ruin. We've known that for a while. But did the numbers surprise you when you did the study? Because this is the first of its kind, right?
Yeah, this is the first time we've run the survey, and yes, I think it definitely surprised me that the number was honestly that low, right? 10,000 pesos is, for some people, just a family dinner, right? But for a lot of people, it's the difference between, being able to survive a healthcare emergency. But I think the other thing to keep in mind, Regina, is that it's not just about them getting sick, but for many times it's also about their extended family getting sick, right? If your uncle, your grandfather, even a second cousin calls you because they're in a healthcare emergency, you are going to be pulled into that as well, right? And that's something that we don't often think about, but I think it's a reality that many families face, regardless of whether you are lower income or even higher income.
And it's very unique to the Filipino family dynamic because one of the other figures in your study showed that only 9% of Filipino families are single unit families, meaning they're by themselves, they're alone. Everyone else is part of a larger family mix. Talk us through that. And how does that compare to other countries?
Yeah, so what we found is that in the Philippines, as in many of our kind of neighboring countries, it's less than 10% of households, which means there's like 2 million households where there's just one person. And the vast majority of people live in one of three kinds of households. There's either one where there's just a single breadwinner, either it's a nuclear family or it's a single parent. A dual earning household, whether that they have kids or not. Or one of the other things we found is that the extended family, the multi-earner household, whether that's what you call a sandwich family, which is grandparents, parents, and kids, or even an extended family, which is that same thing, but with a cousin or an uncle. Most Filipinos, we found, are living in these kind of extended units because in some way that's kind of their health insurance plan, right? If one person gets sick, at least you have other people in the house who can help work or who can help cover. And so we found that a lot of families were staying in these type of extended households to kind of support each other.
What seems to be the crux of the problem here? Is it that obviously we know that the healthcare industry is in crisis at the moment. So that's part of the problem. But what is the crux here? Is it that Filipinos don't know how to save? Is it that they, as you said, they get roped into other people's problems? Is it that they can't rely on HMO and it's not covering enough of the market? What seems to be the crux here?
Yeah, I think there's a couple of factors that play into that. I think the first one is really the fact that wages have grown slower than inflation, right? The things become more expensive, but for a day laborer, they're making the same rate 2 years ago, 3 years ago as they are making today, even as fish, rice has become more expensive.
Yeah.
I think the second thing is these deeply Filipino family
Values,
norms and values,
yeah.
exactly. If your mother calls, your grandparent calls, you can't say, no, I'm not going to help you.
It's so hard to say no.
Regardless of what they're asking
Right,
for, right?
yeah.
And I think that's something else that we found. And third, I think we still see this sense of a lot of kind of anxiety, a lot of fear of the unexpected. And so we find that as a result of that, families are deciding to put off longer term expenses.
Right.
They're not able to make as much progress, for example, on saving for a home or buying a car or a motorcycle, because they're so focused around building this kind of safety net around, just in case something happens.
Yeah, exactly.
But if wages, again, are growing slow, then the ability to build up that safety net, it also becomes a little bit more challenging.
Right. Kumbaga sa Maslow's hierarchy of needs, they can't progress because they're constantly trying to cover their bases. As you said, you can't move forward to purchasing a car, for instance, or purchasing a home, or even planning for a trip,
Yes.
right? Let's look at the top 3 priorities that the people that you surveyed said was on their list. All of them centered on financial stability again. Let's take a look at the numbers there. 70% say they want to be prepared for financial emergency. 68%, I can't read it right now, but
Large savings fund.
there, that's it.
And then-
Having a large savings fund, and 64% improving nutrition and food quality. Again, those are very basic needs. What's the story there?
Yeah, I think there's one interesting finding that we saw, which was that I think when we presented this to people, we asked them to guess, what do you think the top priorities are? Oftentimes, the number one guess is education. And I think a lot of people were surprised, hey, education is no longer in the top 3.
Yeah.
And I think there's perhaps a reason behind that. Tertiary education has been free for the last few years. And so I think that's been one of the big shifts we've seen, is that education is obviously still important, but families are kind of thinking a little bit more about health. I think the second story here is really, if you think about the pandemic, it's been several years since the pandemic. But what I think we feel is that during the pandemic, everybody probably had some kind of experience that was where either they had a healthcare emergency or somebody close to them had a healthcare emergency. And I think there's a little bit of that trauma still, that shock of what happened during the pandemic that has not yet quite left the Filipino psyche. And it's also quite consistent with a survey we ran last year when we asked people, what is your dream? And the number one dream was quite consistent. It was, I want financial security to absorb health scares.
Which is shocking, to be honest, because where's home ownership in that mix, right? Where's education, as you said? Where's building a nest egg for their children, for instance? The Filipino consumer market must be viewed through the lens of the household as a deciding unit, is one of the other things that you say in your findings. What does that mean?
Oftentimes, if you look at how many businesses approach the day-to-day business, it's very much about the individual consumer. They assume that people make decisions. Maybe as one example, if you sign up for a loyalty card, it's always for one person. If you open a bank account, it's usually for one person. You can do maybe a joint account, but it's usually there. Everything is about the individual. But I think if you take a step back, right, and think about even your own family or the families that you know, we all kind of intuitively know that people make these decisions together. They consult their families, they ask their parents, they ask, what should we do?
And in fact, one of the first answers you often hear is, let me ask my family, or
Yes.
let me check with my spouse or
Yes.
kids or whatever, right?
Yes, exactly. But I don't think business has quite pivoted to align with the way that families actually make decisions, right? For example, why is it that grocery loyalty cards are only for one person instead of one family? Even if we know that, at least from our study, multiple members of the family decide what goes into the grocery card. Or, for example, we all know about ambag or toka-toka as means of managing money in the household. I haven't seen a banking app yet that allows you to have an ambag or a toka-toka.
No, that's a good point.
Right.
Yeah.
And again, it's like this is how we live, this is how we talk, but it isn't how our banking apps are designed.
Right, and that's inherent within the Filipino family dynamic. And by the way, when you did the survey, so it surveys 1,500 households nationwide. Did you was there a good cross section of people across socioeconomic classes, or did you just focus on a particular socioeconomic
No,
class?
the survey was nationally representative across age, income, urban-rural split, and even family size.
Oh, wow,
So we
okay.
tried to make it as representative of the Philippine population as
Correct.
possible.
Even then, it's still 64% saying they can't afford. Last question, what can the policymakers take away from your study? What do you want them to take away from this study?
I think for me, the big finding really here is to put the family at the center of everything that we do. We often think about individuals. We often think about what is good for one person. But I think it's important to think about what's good for the family. But I think more than that, it's good to think about what is good for different kinds of families.
Right.
The way an extended family, lola, two parents, kids, tito and tita, the way they act is going to be very different from a nuclear family with one earner.
Right.
Where the parents maybe split the labor. And again, they have very different needs. And then you add the solo parents who
Yeah.
are trying to juggle everything on their own. You add the dinks, the dual income, no kids,
Right.
who are just trying to get by, right? Like
It's the best lifestyle, though. Dual income, no kids.
with a dog.
Right, exactly. But before we end, I just wanted to show the survey cover page and this is the Filipino Family Survey conducted by BCG. Lance Katigbak is one of the authors of this one. Can people get a hold of this? Anyone who wants to get a copy, they can just come to you and say, give me a copy. Or is it available
It's
online?
available online. If
Okay,
you
great.
search BCG, the Filipino Family in a search engine,
Great.
you'll find
Lots of good nuggets in there. Very sobering statistics that I hope the policymakers and businesses take note of. But we will leave that there. Thank you so much for
Thank you,
coming
Regina.
here and talking to us about it. That was Lance Katigbak, Principal at Boston Consulting Group in Manila.